Well, hello there. This is Skip McCoy with Riversoft University. This segment is Clinical Audit Reports. When the state walks into your agency on a surprise visit, they normally want you to produce a few reports to help them with their audit, like a list of your currently active patients, a list of the patients you admitted over the last 12 months, and a list of the patients you discharged over the last 12 months and the reason for their discharge. To produce these three reports, click on the Reports button on the blueprint. In the clinical group, go to Patient Census by Service. Enter the last 2 weeks of service. So that's 6/1, 6/1, 18's good. Okay. This is going to generate a list of every patient that received a visit during the last 2 weeks. We recommend this report instead of the Patient Census by Status report because if you forgot to add the discharge status to a discharged patient, Riversoft will think they are still active because according to the status history, they are. This is a more foolproof way of getting a truly accurate census of your active patients. If the auditor wants an unduplicated census, from the duplicated pull-down, choose unduplicated. Go to the bottom and click on Include Payer Services because most auditors want to see the discipline that each patient is receiving. Then you're going to run the report. You're going to wait a few anxious seconds while that auditor is breathing down your neck. And here's your report. The rightmost columns are Do Not Resuscitate, patient type, which is a deprecated feature from SAM, and admission source. At the bottom of the report are the total patients served, average length of stay, average patient cost, and average cost per day. The next report is also in the clinical group, and that is the patient admissions discharges report. Okay, on this report, I'm going to do it for all offices. And let's assume they want it for the last 12 months, so enter the last 12 months. If the auditor wants an unduplicated census, make sure you choose unduplicated. For the admissions report, we're going to choose admitted first active. We do this because if the patient was admitted and discharged many times, we want to know if their first admission was during this date range. Make sure your payer services include option is checked and generate your report. This will give you a list of your admissions over the date range the auditor asked for. Okay, now the auditor also wants a list of your discharged patients over the same date range. So simply, you've already got the date range in here on this report, change this to discharge, generate the report, and your three reports are all done. So here's your patient status report for discharged. This includes the discharge reason, the total is at the bottom. Here's your patient status report for admissions, and here's your active patient list. You can see that in just a couple of minutes, you will be able to provide a state clinical auditor with the primary list they ask for when they pay you a friendly visit. Hopefully, by being so amazingly quick to produce these important lists, it will set a positive tone for the rest of their visit. Now you are ready to provide patient lists to the auditor when they surprise you with a visit. This is Skip McCoy for Riversoft University, signing off.